Welcome to my breast cancer rehab edition for Pikes for Pink, a social media fundraising campaign to raise funds for the Breast Cancer Research Foundation. Exercises that help restore movement in both the arm and shoulder have been recommended by physical therapists and the American Cancer Society. Since radiation may affect your arm and shoulder long after treatment is finished, it's really important to move the joints and get some blood flow to the area, as well as reestablish neurological control and ranges of motion in the joint. This is why I think functional range conditioning mixed in with the principles and exercises of Pilates can be essential, if not crucial, to helping reestablish good function in the upper body. The following exercises are progressions and will lead into abdominal exercises that aren't recommended until at least 6 weeks after breast cancer reconstruction surgery or whenever your surgeon says it's okay to start. Take your time to reconnect with your central nervous system during these exercises and really try to isolate all the different articulations of the joints that we'll be working on today. Remember, if you feel any closing angle joint pain, back off and consider being evaluated by a specialist or a physical therapist. All right, let's begin. We're going to start seated tall in a comfortable straddle position. Feel free to use a bolster, a balance pad, or a yoga block under your sit bones in order to sit up nice and tall. You want your rib cage stacked over your hips, your shoulders over your rib cage, and your head over your shoulders. We're going to start by getting those scapula to move along the rib cage without affecting the spine at all. We're going to protract the shoulder blades forward, pushing the ball away, and retract the shoulder blades back around the rib cage and spine without allowing the ribs to pop forward. If you feel like you can activate the front side of your muscles a little bit more, press down into the ball as you move the scapula forward and back to activate all that connective tissue in the front of your chest and around the shoulder blade. I like to inhale as my scapula protracts forward and exhale as I pull it back, but there are no rules as long as you're breathing into the side of the rib cage and moving the scapula without affecting the spine. Next, we're going to move into segmenting the thoracic spine by articulating through the neck, one vertebrae at a time, segmenting down only into the thoracic spine so that the lumbar stays nice and tall. Press the palms of the hand into the ball and allow the scapula to protract forward as in the previous exercise. Reverse out of this by segmenting each vertebrae back into an upright position, being sure that the lowest vertebrae stacks before the one above it. Take an inhale at the top and repeat, segmenting through the neck and the upper spine. Lumbar stays tall. Press down into the ball as you restack the vertebrae, one vertebrae at a time. Take your time through any segments that stick together or that don't segment. Think about using the whole front side of your body from the chest and the abdominals to help articulate the spine. As you segment each vertebrae back up to neutral, be sure to draw the shoulder blades back and down without allowing the rib cage to arch forward. Segment each vertebrae down into flexion and segment each vertebrae back up into neutral. Keep both the arms and legs active, and that will help keep the lumbar nice and tall and allow you to focus on really segmenting through each vertebrae, trying to reestablish mobility and control in the thoracic spine. Now that we got the upper body moving and segmenting, we're going to move down to the lumbar spine, but still working towards that pike progression. So we're going to reach the sit bones back and move the pelvis into an anterior tilt. Depending on your hip flexion flexibility, you may not go very far, or you may want to prop your pelvis up on a pad or bolster if you have it already. Starting at the sit bones, Begin to posteriorly tilt the pelvis, letting the sacrum follow, and then each lumbar vertebrae one at a time. The idea here is to segment into flexion. Then again, leading from the sit bones, pressing the sacrum forward, and then each lumbar vertebrae into extension. Sit bones lead, and then try to focus on segmenting each vertebrae into flexion, and then each vertebrae into extension. You'll notice I'm slightly bending my legs to pull myself into the anterior tilt. Going into posterior tilt, I'm pressing through my heels and feeling my hamstrings pull my sit bone to assist that posterior tilt. Another option is to hug the ball in order to get better activation through the front of the body. So lots of chest, arms, and abs in addition to the segmenting vertebrae. Keep working through that lumbar segmentation, allowing the legs to help assist pull the pelvis into your anterior and posterior tilts, and squeeze the ball, activating the upper body, but minimizing the amount of flexion and extension that happens in the thoracic spine and not allowing the upper spine to collapse onto the ball. Get as much tissue firing as you can through the whole front of the body as well as the backside down through the legs to really start to activate the entire body to get ready to further progress spine segmentation with loaded abdominal work leading into Pikes. Now that we got the spine mobilized and the core fully engaged, it's time to move on to the hip flexion required for Pikes. Besides the flexibility in the back of the legs and spine needed for hip flexion, there's also the strength and control needed in the front side of the hips. Sitting up tall on top of the sit bones, take an inhale, engage the abs, back, and even press into the ball with the hands, and lift the right leg as high as possible, then adduct towards the ball and lower down, sustaining the same spine and pelvis position, and then again lift the leg, abduct out to the side, and lower back into your small straddle. Before and during lifting the leg, keep tension throughout the torso and arms to help increase strength and control in this area. Do at least 5 sets on the right and 5 sets on the left. Don't worry about how high the leg lifts. The important thing is to keep a good spine and pelvis position. Keep tension in the torso, arms, and even the leg that's not working in order to strengthen and develop the control needed for proper hip flexion without compensation. Continue with another set back on the first leg, or try a variation by lifting the right leg, adducting, then lifting the left leg and adducting towards the ball, then lifting and abducting the right leg, and lifting and abducting the left leg. Variations offer the body different movement and problem-solving opportunities, perhaps discovering strengths and or weaknesses depending on the position that you're moving from and into. Here I've tried a few sets, initiating each direction with my right leg and then again repeating initiating with my left leg. And then for the final challenge, lifting both legs at the same time and adducting towards the ball, and then lifting both legs straight up and abducting away from the ball. Again, trying to sustain the same position and keeping tension in the torso and arms. Cramping can sometimes follow these concentric exercises, so it just means you need to work the strength and control in these ranges so that your neurological system has time to adjust. Now that we mobilized, strengthened, and developed some control in the areas needed for a pike, we're going to tie it all together into what seems like a preparatory Pilates exercise, the roll-up, but we're going to actively engage everything that we just covered. Going back to the segmentation of the lumbar, curl the spine down towards the floor only as much as you can control in the spine and the abs. Take an inhale at the bottom, wherever that is for you, and instead of just curling up, actively try to segment the thoracic spine back into that flexion that we were working earlier and engage the hips into hip flexion. Then increase your hip flexion by extending the sit bones back, then articulating each vertebrae into extension until you've come into a fairly neutral spine position. Sit up tall on top of the sit bones and repeat. Articulate the lumbar towards the floor with as much control as possible, only going as far as you can sustain the flexion in the lumbar. Then actively bring your thoracic spine into a deeper flexion and engage your hip flexion, pulling yourself forward. Increase the pike stretch by extending the pelvis and spine into extension, and then sit up nice and tall. Keep the arms actively engaged towards the ball and just use the fingers to drag the ball towards you as you curl down and to push the ball away from you as you curl up. See with each consecutive set if you can segment through vertebrae that are segmenting together, and possibly seeing if you can get the spine lower each repetition towards the floor while still maintaining the spine flexion and control. The ball helps you stay engaged in the front side of your body, but also might provide just enough assistance so that you can work on the mobilization, strength, and control of the spine and hips. And now we're going to go back to what seems like the first exercise that we did, which were the scapular protractions. But we're going to add the weight of the ball, in addition to squeezing the ball, adducting the upper body. Again, you want to protract the scapula without affecting the spine, which includes any neck and head movements. And then go ahead and curl down and repeat that same exact movement, but with the arms directly over the shoulders, protracting the shoulder blades, pressing the ball to the ceiling, and then pulling the shoulder blades back. Not quite in a complete retraction, but just so that the scapula is pressing flat into the mat. Did you know that the muscles that protract the scapula are connected to the tissue of your obliques and your abs? This is why it's such an important aspect to cover when re-establishing the strength and control of the upper body with abdominal work. Now, as you reach the arms overhead, keeping the arms straight, see if you can add the protraction of the scapula, hugging the scapula around the ribcage as the arms go overhead, and then pulling the scapula flat back into the mat as the arms return over the shoulders. Exhale as your arms reach overhead, protracting the scapula forward around the ribcage, not up towards your ears, and then inhale as you return the arms back across from the chest, drawing the shoulder blades back towards the mat. It's important to have this scapular engagement as the arms go overhead to sustain a good spine and core connection, especially as, continuing with the progression, we lift the legs, further extending leverage away from the center of your body. Repeat with the legs in tabletop, and sure, if you want to go ahead and add some additional progressions, you can extend one leg away and then bring it back. And if you're feeling really daring, go ahead and extend both legs. Whatever you choose, be sure to protract that scapula as the arms go overhead, and the spine should stay fully connected to the mat at all times. Again, repeating and combining several of the movements that we've already covered and progressing these movements, we're going to load these ranges with body weight against gravity and using pressure into the ball as you're able. Remember that scapular protraction for really good Ab control in flexion. Here it is. On an exhale, going to flex the spine, which is the thoracic mobilization that we did earlier. Combine that with the scapular protraction, and using a strong exhale, drawing the ribs together and down towards the waist, fold up into a chest lift or abdominal curl. Inhale into the side of the ribs and pull the scapula back towards the mat. Then exhale, repeat the scapular protraction with the neck and thoracic flexion. And inhale, expand the rib side and pull the scapula back towards the mat. Combining everything that we just worked. In addition, if you're able, try pressing the palms of the hands into the ball as well as into the legs as you fold up. Now let's try loading the lumbar spine with flexion by curling the spine up as much as you can, then controlling each vertebrae back down to the mat. This may be very small or very big, depending on the strength and control that you have in this area. You're working against your body weight and gravity, so the movement doesn't have to be big. It's about the intent of flexing the lumbar spine and controlling through the front side of the body, as well as working the hip flexion that we discussed earlier. Again, as you're able, pressing the ball into the legs and the legs into the hands. To further progress, you can extend the legs and do the same movement. It may look like I'm just flexing my hips, but I'm really trying to articulate the pelvis into a posterior tilt and lumbar flexion, then controlling that movement down. Pressing my legs into hip flexion, using my hands as resistance, and then pressing my hands into my legs as my legs resist as I lower. Try not to make this a seesaw action, but rather pressing the spine up with the hands resisting, and then pressing the spine down with the legs resisting. By focusing on the joints independently in order to have them work interdependently in exercises that combine multiple joints working at the same time, we can address weaknesses and ranges of motion that may be lacking appropriately and develop the strength and motor control needed in the connective tissues in order for them to execute exercises like the pike. I hope you enjoyed my breast cancer rehab edition for Pikes for Pinks. Be sure to visit our team page to donate to the Breast Cancer Research Fund. Thanks for watching.